This is an appendicular skeleton.
Okay, we're going to start out with the thorax, which then is the chest area which protects the heart and the lungs. And so the thorax then consists of the sternum, and this is the large bone that is right down the anterior medial side of the chest, and the heart sits right below the sternum. The upper part of the sternum then is the manubrium. That's about the upper 1/3. On the very top of the manubrium is a notch which is called the sternal notch, or suprasternal notch, or jugular notch. And through that notch then would be where the trachea is, and the carotid artery to the brain, and the jugular vein coming in from the brain. Then on the lateral side of the manubrium is then the clavicular notches, and the clavicular notch then is which will tie into the clavicle. The sternal angle is the joint here between the manubrium and the body. The body is this whole central portion of the sternum. Okay, and then the lower tip of the sternum then is the xiphoid process. And the xiphoid process then is a vestigial structure, but you have to be real careful on the xiphoid process when a person is doing CPR, so that they do not break that xiphoid process and damage the heart. Okay, attached between the vertebra and the sternum, attached via costal cartilage then, are the ribs. And the ribs are put into different categories, and we end up with the ribs 1 through 7, which are called the true ribs, and these true ribs attach to the sternum via the costal cartilage. So 1 through 7 then are true ribs. 8, 9, and 10 are considered to be false ribs, because their costal cartilage ties into R7, so they tie into R7. And the last 2 ribs, which have no connections, are the floating ribs, and those then are R11 and R12. Now, if we take a typical rib, like this here, then this would be a typical rib. The head of the rib is on the posterior medial side, and the head of the rib then attaches into the vertebral column and into the body of the vertebral column. So the point of attachment to the body of the vertebral column are these facets, and there's a superior articular facet and an inferior articular facet, and then in between is a interarticular crest. And so this then is the point of attachment right into the body of a vertebra. Now also the neck is the constricted area below the head, and then the rib is going to connect into the transverse process of a vertebra. And so there is the articular part of the tubercle, which is directly connected to the transverse process, and then there's the non-articular part, which is where ligaments attach then to the transverse process. And ligaments go from bone to bone. So that is the non-articular part. The extended portion of the rib then is the shaft. Okay, and then because the rib is coming out laterally from the vertebral column, and then goes around to the anterior portion of the body, where it changes direction then is called angle. And so the angle then is where the shaft is coming out laterally from the vertebral column, and then is projecting anteriorly. So this then is the angle. On the medial insert, the medial inferior surface area, right down here then is a costal groove, and that costal groove then is for nerves and blood vessels that are running along that medial anterior portion of the rib. Now there are spaces between the ribs, and that spaces between the rib is called the intercondylar or intercostal space. Okay, the next portion is on the appendicular skeleton, and the appendicular skeleton has different parts to it. And the first part then is the pectoral girdle, and the pectoral girdle then consists then of a clavicle, which is this bone here, and a scapula, and they then provide the base then to the arm. And so we end up with the two different bones making up the pectoral girdle, the clavicle, and then the scapula. Now when we look at the clavicle, this is a stabilizer bone. It helps stabilize that joint, our shoulder joint, and it has different parts to it. This part that is on the medial side is the sternal extremity, which then is a tying into the to the sternum. So right there would form that joint, which then is the sternal clavicular joint, where these two are coming together. The other end is then the acromion, and it's flatter and it will project anteriorly, and it connects then into the acromion of the scapula. And so this then is the acromion of the scapula, and that will attach then into the acromion extremity of the clavicle, and they then will form the acromioclavicular joint. Now there are ligaments which go from bone to bone. Excuse me. There is then on the inferior lateral surface a coronoid tubercle, and this is on the inferior lateral surface, and that would be then for ligaments that are going then and attaching to the coronoid process of the scapula. So it's going to go down and connect to this coronoid process of the scapula. On the inferior medial side is this roughened area here, and this then is the costal tuberosity, and that then is attaching into the costal cartilage coming off the sternum, and so they're attaching, the tissues attaching, holding it in place on that side. The other big bone of the pectoral girdle then is the scapula, which also is called our shoulder blade. And this is a huge, broad, flat bone for attachment for a tremendous number of muscles, ligaments, and tendons. Okay, and so the scapula then has different regions and parts to it. One of the areas of the scapula that is projecting posteriorly is the spine of the scapula, and this spine then increases the surface area so that there's much more area for the tissue to connect to. The flat anterior portion of the scapula then is called the body. Okay, it does connect into the arm, to the humerus bone of the arm, and that socket then is called the glenoid cavity. So this glenoid cavity then is then for the socket of the humerus. There are borders on the medial side. Our vertebral side is that medial vertebral border. On the opposite side then is the lateral or axillary border. And on the top then is going to be the superior border. Okay, so these are the three borders: superior, medial, and lateral. Now each one also has an angle, and where the medial and lateral come together, they form then the inferior angle, and on the opposite side, where the superior and medial come together, forms the superior angle. Now there is a projection that goes anteriorly. This is called the coracoid process, and this coracoid process again for attachment on the anterior side. So we have muscles and tendons and ligaments attaching to the coracoid process. Also there's a series of fossas, which are depressions. So above the spine then is the superior fossa. Below the spine then is the inferior fossa. Anterior to the body then is then the or subscapular fossa. So as the anterior portion of the body is the subscapular fossa. Now the upper arm bone then is the humerus. And so the humerus would attach in somewhat like that. Okay, and the head of the humerus then, the upper arm bone, is this portion here, which is going to project medially and attaches then to the glenoid cavity. Now the humerus is going to have two necks. Right below the head, in this region right through here then, is the anatomical neck. But then right down through here then is what's called the surgical neck, and that's because this is when a bone breaks of the upper portion of the arm. It's going to typically break right in here, and that then is the surgical neck. Now there is projections for attachment of muscles, and on the lateral side is the greater tubercle, and then going on the anterior is then the lesser tubercle, and these are all points of attachment. Now between the two there is a depression, which is called the intertubercular sulcus, and that intertubercular sulcus then is for tendons that are coming off the bicep muscle. Okay, the body of the humerus then